Government now says the first batch of vaccines is on the way, and Kenyans could begin getting jabs as soon as this month. We're going to begin our broadcast with our very own Dorcas Wangira, who reports the country could receive more doses from CDC Africa. This as 123 more people tested positive for the virus. Take a look.
Kenya expects to receive 24 million doses of the AstraZeneca vaccine in February, as announced by Health Cabinet Secretary Kagwe January 7th, Thursday last week. However, there is a possibility that vaccines other than AstraZeneca could arrive in the country before the end of this month.
We have engaged various institutions, of notably Gavi, who are the ones who are leading in the acquisition of the vaccines that are expected in Kenya, and therefore it is possible that vaccines may come here before the date that Gavi has given us, in accordance with the arrangements that are being made by both the public and the private sector.
Health workers and other professionals working in the front line, such as teachers, will be given priority for vaccination, and the vaccination jabs will be voluntary. Besides AstraZeneca, the COVID-19 vaccine developed by AstraZeneca and Oxford University, Kenya is also considering other vaccines.
The discussions that have been going on between the Africa platform, the suppliers, all the way from Pfizer, Moderna, AstraZeneca, including also some of the Chinese ones such as Sinovac and Sinopharm. All these organizations are involved in the discussions to see when vaccines are coming to this country.
But even as the country awaits the vaccine, 123 more people have tested positive for the virus, among them a student who contracted the virus from a parent. This was from a sample size of 4,948. This brings Kenya's caseload to 98,555 cases. Kenya has recorded the first case of a student testing positive since schools were reopened.
What I would like to urge from the parents is that if you are tested positive, and if any of the parents or any of the siblings is in isolation, then it is very important that you keep your children under observation at home until tests are done on those children.
412 patients have recovered from the disease, and 675 patients remain admitted in hospitals. 4 people have died, bringing the total number of deaths to 1,720. In November, Kenya recorded high numbers of COVID-19 cases, past the 1,000 mark in particular days, and it was believed that then we had reached the crest of our peak. But in the last few weeks, the numbers have been low, and the test positivity rate well below 5%, begging the question, have we flattened our curve?
We would be thinking about declaration of a flattened curve. However, we cannot do so at the moment because we have not quite taken into consideration the impact or the effects of the holiday season, as well as the effects of opening the schools.
Dorcas Wangira, Citizen TV, Nairobi.